Welcome to this week's Health and Care update about the coronavirus pandemic in Devon. It looks like the current restrictions are having a positive impact and we're starting to see cases come down in Devon. I'd like to hand over now to my colleague Simon Chant, who's going to go through the data in a bit more detail with you.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 28th of January. We start with the national picture. Cases are falling nationally. The number of tests remains high due to increased local testing capacity. Deaths has continued to increase and are at the highest level during the pandemic. Now for the local picture. In Devon, for the latest available week, there were 997 COVID-19 cases and 52 deaths, with rates of both below the national average. Case rates are slightly higher in West Devon. Cases of COVID-19 are now falling in Devon, but are still above the levels seen in November and December. Case rates are currently highest for those aged 20 to 39, but are falling in all age groups. The data in this summary is drawn from Devon's COVID-19 dashboard and the National Coronavirus Tracker, where the latest available information can be found.
Thanks, Simon. Well, clearly, it's good news that we're starting to see case numbers come down. The case numbers we're seeing today, though, are still much higher than they were in November or December. We're still seeing outbreaks in workplaces and in care homes. So now is not the time to drop our guard. Please stick to the national lockdown rules. Stay at home. Only leave out your home if it's essential. And if you do have to go outside, please keep your social distance. Wear your face coverings when you're indoors, and remember to wash your hands regularly. And crucially, if you're contacted by NHS Test and Trace and instructed to isolate, you have to isolate for 10 days. And that includes you if you've had a vaccine. The vaccine does not stop you getting the virus and you will still have to isolate. I'd like to hand over now to Dr. Paul Johnson from NHS CCG. Thank you.
While cases in the community are stabilising, hospitals across the southwest are continuing to treat high numbers of patients. So, until the virus is under control, please continue to do your part. Follow the social distancing guidelines, even if you've had a vaccine. The vaccine is great news. More than 100,000 people across this county have received their first dose of the vaccine, which is a huge credit to you and to the health and care staff who have been working tirelessly to vaccinate people as quickly and safely as possible. Here in Devon, we now have 2 new large-scale vaccination centres at Plymouth Argyle Football Club's Home Park Stadium and at West Point, Exeter. And they started vaccinating those priority groups of patients on Tuesday. These sites mean thousands more vaccinations will be given every week in Devon and provide local people a wider choice of options when they receive their invitation for an appointment. Anyone who cannot or does not want to travel to one of these sites will still be able to be vaccinated by their local GP service. Nobody needs to contact the NHS, as you will be invited when it's your turn. And please don't attend any of these sites without an invitation, because we won't be able to offer you a vaccine. In northern Devon, vaccinations are taking place at the GP-led centres in Barnstaple and Holsworthy, as well as at North Devon District Hospital. And the site at Barnstaple at the Leisure Centre is capable of vaccinating a similar number of people to the large-scale vaccination centres in Exeter and Plymouth. Now, having personally visited a number of these vaccination sites, including the Riviera Centre in Torquay and Home Park in Plymouth, it's clear to me how hard staff and volunteers from the NHS, from local councils and businesses, and from the local community have worked to make these centres a reality. And I would like to thank everyone involved. Each GP practice is working through their patient lists in priority order as fast and as safely as possible. As these sites all started vaccinating at different times, some are more ahead than others. So please be patient. You will be contacted as soon as your local centre is able to offer you a vaccine. Mobile teams and day clinics are also taking place to bring vaccination facilities closer to people in more rural parts of the county. You can help the NHS vaccinate people as quickly as possible by staying at home, by getting your vaccine when invited, remembering that we'll contact you, so please don't call your GP practice or local hospital, by acting like you have COVID even after you've been vaccinated, as you may still transmit the virus, and by following the government advice about social distancing, about hands, face and space, and by using the NHS in the best way. Think 111 first, or self-care, or going to your pharmacy or to your minor injuries unit.